I'm
Hello.
Sherry Sussman, Executive Editor, Springer Publishing Company, and I'm here with Dr. Bill Worden, the 35th Annual ADEC Conference, Association of Death Education and Counseling. Bill Worden is the author of Grief Counseling and Grief Therapy, a handbook for the mental health practitioner, now in its 4th edition. Bill, how many years have you been coming to ADEC?
Oh goodness, Sherry, I started the ADEC. Yeah, we started in the state of Maryland in a cow barn, 4-H club cow barn.
How many people were there?
Oh, probably about 15 or 20, and they were mainly people who were teaching courses in death education. These were not bereavement counselors. These were really educators back there. So that's how the organization began.
Wow.
Yeah.
And now we have 570 attendees.
Yes, it's
so
grown.
That's pretty
it's
nice.
Grown.
Right. What?
It's become an industry. I sometimes get nervous. There's so many people around wanting to hold my hand in a bereavement situation, you know. And the assumption is sometimes that everybody needs grief counseling. I don't believe that.
Isn't that a big controversy going on right now in that regard?
Well, I don't know, but when you have an industry, then you create a market for whatever you're doing. I don't really know the answer to that.
So, Bill, what brought you into this field?
I went to a cocktail party, and I was working at Boston University Medical Center, and the chief of the outpatient unit had a party, and I went, and he was a little bit high, and he was getting everybody else high, because faculty-student parties aren't always the...
What year was that?
This would have been about 1968, 67, yeah. And anyway, no, but he just said, I have a colleague at Harvard who's looking for a collaborator, and I want you to meet him. And so I met Avery Weissman, and that was the beginning of this whole thing. But we were doing studies of death and suicide, not necessarily studies of bereavement. So that came later.
The Harvard study became very famous. Isn't that true?
Well, if you mean the Harvard bereavement study, that was just being completed when I went on the faculty at Harvard in '68. And we were looking at widows and widowers in Boston under 45 years of age. So studied young widows and widowers and following them for 5 years after the death of the spouse. So that's sort of my first, awareness of bereavement.
And how did that then parlay into your writing the first edition of Grief Counseling and Grief Therapy?
Well, what I was doing was doing some teaching, some continuing education teaching for the University of Chicago on death and dying, along with Dr. Kubler-Ross. And Mary Conrad was director of continuing education, and she suggested maybe we should do a workshop on grief and bereavement. We set it up and we limited it to 100 people, and oversubscribed, but we kept it at 100 because we wanted to do not only lecturing and teaching, but also some small group kinds of experiences. So that was really the beginning, and then they realized that people were taking notes, and maybe somebody's going to take these ideas and run with them. So that's how the book began. So I put the book together, and Kastenbaum suggested I approach Springer Publishing Company, and the rest is history.